Ang COVID-19 ay panibagong kontrabida sa buhay nating mga Pilipino.
Habang unti-unti tayong bumabangon muli, patuloy ang laban natin dito.
Para matalo natin ang kontrabida, we can be the solution.
Kaya mong maging bida, basta susundin ito.
B. Bawal walang mask.
I. Sanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Dumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
Be the solution sa COVID-19.
Organic acai has very high levels of antioxidants and essential nutrients that help keep your immune system strong. Organique acai premium blend and freeze-dried capsules daily to help increase your resistance against harmful viruses. Keep yourself and your family healthy and protected with Organique.
Mahalagang paalala, ang Organic Acai Premium Blended Freeze-Dried Capsule ay hindi gamot at hindi dapat gamitin panggamot sa anumang uri ng sakit.
Of all the tough decisions you have to make today, your family's health doesn't have to be one of them. Not when you have the choice to go organic and live full, natural.
Previously on Wellness
po, no? Kung hindi talaga maiwasan na kumain ng street food, ang tip natin dyan ay hanggat maaari yung mga so call out po natin yung mga nagbebenta, mga street food vendors. Kung maaari po, meron kayo meron kayong pangkuha nung sabaw or nung not sabaw yung condiment ninyo, yung suka ninyo, no, yung siyasawsawan.
Wellness Wednesdays with Organique. We care because you matter.
In support to DOH Bida Solution campaign.
Hello and good afternoon. Welcome to Wellness Wednesday. I'm sure you have noticed from our background that we did a little studio upgrade. It's called a green screen. We'd like to thank our team for this. Looks amazing. I'm kind of jealous of everyone who's been doing Zoom with a green screen for the longest time. But anyways, before proceeding into today's episode, don't forget to like, comment, and share this week's episode so that, first of all, our family and friends might chance sila to join our Facebook game, or actually Instagram and YouTube game. So our Instagram and YouTube game, you're going to have to follow us on Instagram and subscribe to us on YouTube, then screenshot it, comment it below so that you get a chance to win a blister pack of freeze-dried capsules and either a box of 10, either acai choco or acai coffee. Now, these are really, really great products, and we've got a lot of great feedback on them. So share it along so that everyone has a chance to win. And then moving on, today we are going to be talking about glaucoma. So, why glaucoma? Did you know that there are over think the number was over 1 billion cases of blindness in the world, or visual impairment in the world. And I think like 37 million cases of blindness, with 80% of those cases being preventable, actually. So 37 million people are out there blind when they could have actually done something about it. And some of those cases, such as glaucoma, are irreversible. In fact, glaucoma is the leading cause of irreversible blindness in the world. And that is why today we have here our special guest, Dr. Christine Cortes, who is an ophthalmologist in Cebu. Now, Dr. Christine will be sharing with us just exactly what is glaucoma, what causes it, and what we can do about it, if we have it, or how can we prevent it in the future. Hi, Doc.
Hello. Hello, Luisa. Good afternoon.
Hi, good afternoon. Kamusta?
I'm doing well. Okay naman.
Okay, so Doc, do you mind sharing to our viewers over here what's your experience with glaucoma and with eye health in general?
Actually, I just start by introducing myself again. I'm Dr. Christine Cortes. I'm a practicing ophthalmologist for about maybe over 10 years now. A few years ago, I decided to go into glaucoma specialty training. So back in 2018, I resumed practice. So aside from seeing eye patients with glaucoma are referred to me in our locality so that they can be evaluated and taken care of. So now, and I think that's why I am here today with you guys.
All right, thank you, Doc. So see, mga viewers natin, we get the best resource speakers, the ones who really truly know exactly what kind of diseases we're talking about. And so, Doc, I think we'll just jump right in. So first of all, Doc, can you tell us what exactly is glaucoma?
Yeah. So first and foremost, we need to understand what glaucoma is. No? So glaucoma is a disease, no, that damages the optic nerve. So ano yung optic nerve? Optic nerve is yung ugat ng mata. No? So it's very important for good vision. So why? This optic nerve, ito yung structure na nagko-connect ng eye, ng mata, sa utak. No? So kung may nakita yung mata, it has to travel. Kailangan niyang dumaan dun sa optic nerve para dumating sa utak, that is maproseso yung impulses. Tapos makikita, malalaman mo kung yung nakita mo. So very important yung optic nerve. So in glaucoma, yung optic nerve yung na-damage. No? So mostly, no, kadalasan sa nangyayari sa may mga glaucoma, nare-relate dahil mataas yung pressure ng mata. No? Yun yung usual na nangyayari. So, very common to sa mga elderly, yung mga over 65, pero it can still occur at any age. No? So kahit yung mga bata, no, kahit yung infant, no, kahit yung mga newborns, they can still have glaucoma.
Oh wow, newborns.
Yeah.
That sounds pretty serious, Doc. So yeah. So Doc, if it can be, if anyone from any age can get glaucoma, how do we know what it looks like? First of all, what are the symptoms ng glaucoma?
Actually, many forms of glaucoma have no warning signs. No, so the effect is so gradual that you never notice the change in vision. No, so but we can mention the symptoms because the symptoms and signs will vary on the type of glaucoma that you have and the severity or the stage of the condition. So may type na wala kang ma-feel, no? Pero yun yung majority. Wala kang ma-feel muna. And later in the stage, you will feel those patchy vision, yung tunnel vision, yung parang nakatingin ka lang sa tunnel, yung ganun. But yung iba naman, they will present yung mga this one, no? You so seeing halos around lights, yung parang nasisilaw ka when you look at the light, parang may halo siya. And then sudden vision loss, no? So biglang dumabo yung paningin, no? And then that is accompanied na with painful red eyes, no? So masakit, tapos mapula yung mata, no? And then especially in infants, when you look at them, their eyes look large, tapos hazy, no? So yun yung makikita in infants. And then,
Right.
in some glaucoma, because of the severe eye pain and headache, no, you will have upset stomach and nausea, and then magsusuka ka din, no? So, interrelated siya in the severity.
Right.
Visual
So,
symptoms
Doc, so sa mga parents, no, those are the kinds of things they should be looking out for in infants. Are there any other symptoms or signs to indicate to parents for infants?
Yeah.
Because we can't check the others, no?
Yeah. So they, aside from their eyes look hazy, when the baby, maybe in a few months old baby, they have yung mga nagluluha, no? Tapos parang nasisilaw sila, no? Parang nagko-cover sila ng eyes nila pag may mga bright lights. Tapos yung mga squinting, no? So parang nililiit nila yung mata nila to see clearly, yung mga ganong signs. So they just have to make sure that they bring that child even at a very young age to the appropriate ophthalmologist, no, para ma-evaluate ka agad. Kasi once glaucoma is there and once it has caused damage, wala nga tayong magagawa, no? Kasi like you said, it is irreversible.
Yes. Okay, Doc. So mga viewers natin that are parents that have young infants, please keep out for these signs. You can save your children's eyesight.
Yes.
Unfortunately, glaucoma is irreversible. So, Doc, I notice ibang symptoms is kind of very common to lots and lots of diseases like stomach pains, no, and nausea. So, how do I know whether I should be approaching an ophthalmologist for that kind of diagnosis? Is it just stomach pain, or do I see two symptoms together, stomach pain and halos?
Usually you will feel all those halos and the headaches and the eye pain and the eye redness before you develop the nausea and the upset stomach. Yes, in severe cases. So they vomit, that's why they go to the ER and see a general practitioner. And then that doctor can tell if the patient needs to be referred to an ophthalmologist. Kasi a lot of patients are seen at the ER, no? Thinking they have stroke because they have headache at severe nagsusuka sila, and then they just end up in the doctors and the eye clinic because may glaucoma attack sila. Pero yung iba naman na-admit, they underwent several tests because yun nga, minsan early stages, mami-miss out yung diagnosis of glaucoma.
Right. So, Doc, speaking of diagnosis, once I have all these symptoms and I go to the doctor, what does the diagnosis look like? What are the tests that I'm going to have?
Yeah. So once you get in the eye clinic, no, so you need to be interviewed, no, so the doctor will not check you right away, no, so the doctor will get a thorough history taking. So yung medical history, no, so yung doctor may tatanong yung mga comorbidities mo, yung mga sakit mo, kung may may mga gamot ka nga tinitake, no, yung mga maintenance mo, yung family history mo, no, kahit na kahit na yung sabihin mo lang yung may relative ako na may problem sa mata, no, yung mga ganon. And then also history of previous eye trauma, mga ocular trauma, ocular surgeries, yung mga ganon. After that, kung nakuha na yung comprehensive history taking, then the doctor will evaluate yung routine muna na eye exam, no? Papabasahin ka, tapos titingnan yung mata, no? I-evaluate yung pupil up until doon sa likod ng mata. Kasi yung optic nerve, makikita doon sa likod. So you need a special instrument, a special lens to be able to evaluate the nerve. Tapos yung angles din, kasi yun yung very important structure you have to consider in glaucoma, i-check din ng doctor. So if you have risk factors, and then if you have, the doctor suspects glaucoma in the patient, then doon na siya magdadagdag ng iba pang mga test, no? Kumbaga may mga iba pang laboratorio na gagawin, no? So yun yung mga ultrasound or mga scan doon sa nerve, no? Mga visual field test, o maliban doon sa mga pressure na so mga further exam kung kailangan para ma-detect.
Doc, you mentioned that first of all, the doctor will interview you, no, for mga risk factors. So, can we talk about first the causes of glaucoma and what those risk factors are?
Yeah, so first and foremost, we need to know why um, um, pressure will build up. No, bakit tataas yung
Right.
pressure? So, sa loob ng mata, may gumagawa ng tubig. No, may fluid tayo sa loob ng mata. So, yung fluid, may production. Meron din siyang drainage, no? Parang may outflow din siya. So, there should be a balance between the production and the outflow. So, pag yung outflow, yung drainage natin, barado or may problema, magbi-build up yung tubig inside. So, once mag-build up, doon na magsimula tumaas yung pressure. So, causes like, to mention a few, no, yung burn or chemical injury, mga severe eye infections na hindi matreat kaagad, mga barado na blood vessel sa loob ng mata, no? Pwedeng mag-lead to glaucoma. Saka mga inflammatory condition, kunyari mga may thyroid problems. Not iba pa, mga trauma, no, maraming pwedeng dahilan sa glaucoma.
Right. Right. So those are the causes, no, Doc?
Yes.
What are some accompanying risk factors for people? Yes.
Yeah. So, since yung chronic form ng glaucoma, no, majority ng glaucoma, wala kang mafe-feel up until advanced na yung stage. You have to be aware of certain risk factors. So, if you depende sa race, no, African race, Irish, American race, Russian, yung naka-flash, yun, may high risk sila, no? Then age, no? So if you're over 60 or over 40 with a strong family history of glaucoma, so kailangan medyo alert ka for that. Nearsightedness and farsightedness, you should be extremely nearsighted or farsighted. It doesn't mean that kung nakasalamin ka, may glaucoma na kaagad. So, ano pa rin?
Okay.
Example pa rin.
Anong grade, Doc?
Yes, ma'am.
Sorry, excuse me. Anong grade, Doc, for nearsightedness and farsightedness do we consider a risk?
Yeah, actually wala namang talagang figure na sasabi na risk ka na. Yes, kasi dependent sa age.
Okay.
Yeah. So anyway, as people kasi wearing glasses, they tend to go to at least an optometrist, diba? So they will be monitored. So the optometrist can refer or can advise that patient that need to be evaluated further if suspected glaucoma. And then after that, poor vision. No? So another risk factor, poor vision, especially in elderly. So kung elderly tapos may poor vision, meaning they might have cataracts. So long-standing cataracts can increase the risk for the development of glaucoma also. Yan.
Right.
So, iba pang...
Yes.
Sorry,
go ahead.
Yes, yung mga medical conditions like yung mga diabetes, yung mga long-standing diabetes, tapos poorly controlled. Tapos may mga iniinom kang gamot like yung mga steroid, yung mga gamot for bladder control, o tsaka yung mga seizure, at tsaka yung mga common natin na para sa ubot sipon, yung mga cold remedies, no? Meron din silang tendency to increase the intraocular pressure. And then if you have history also nung injury sa mata, no, natamaan yung mata mo nung bata ka pa, no, then you have the risk also of developing glaucoma and eye surgery, no. And then yung cornea, if they are thinner than usual. So yung cornea, yun yung structure sa yung structure sa pinakaharap ng mata, no, yung parang crystal. So that has a normal thickness. So kung mas manipis ka doon sa average, then mas mataas yung risk mo for the glaucoma. No, mas less protected ka, kumbaga, kung thinner yung cornea mo.
Right. So there's still a lot of risk factors, no?
Yes.
With glaucoma.
Mm-hmm. So certain medical conditions, again, we already mentioned diabetes, no? So high blood pressure, heart diseases, and sickle cell anemia, no? So medyo mga red sign to, no, mga red flag signs to, na you have to go further, to undergo further evaluation for glaucoma if you have these conditions. And again, lastly, high eye pressure. So this is a risk factor. Actually, this does not describe glaucoma in itself. No, high pressure, the high intraocular pressure is a risk factor, pero very important siya kasi ito yung minomodify ng doctor, ito yung ginagamot, no, yung gamot to modify this para makontrol yung glaucoma. So very important siya na risk factor. Yung
right. Right. Actually, at first, Doc, when you said na high eye pressure, I was already thinking high blood pressure would be associated, no, with glaucoma. But then yung high eye pressure is also very specific that you can only really find out sa like diagnosis or sa regular eye exam, no?
Yes, yes.
Yes. So, Doc, before proceeding to the next step, I just want to take a moment here to look at our comments. And acknowledge some of our viewers. So here we have Frankel Anyasco Goyonan, we have Nair Mendoza, we have Crizia Roldan, Francisco Dagos, we have Frax Zinlin, Jeff Flores, we have Mari Lynn, we have Michael Pot Pagtama, Neil Marie Rio, Nikki Beroya. We have so many comments, Doc. Jefferson Dizon. The good thing right now is I'm not really seeing too many questions, meaning we are either answering them or they're going to ask them all in the end.
Okay.
So, yes. So Doc, move. Yeah, sorry, go ahead. I think it's our internet connection. I can't really tell when you're stopping or talking. Go ahead.
Yeah, it's okay. Actually, maybe some of the questions will be answered when we finish, and then all those questions that are not taken up, then we'll just answer them.
Yeah, for sure, Doc. For sure. So you told us a bit earlier, no, about diagnosis. Let's just run through the slides for that.
Yes.
Could we pull up the slides for diagnosis, please? Yeah, so let's just run through the slides so that our viewers get a better visual on this. Okay, so first diagnosis, quick run through, just to recap.
Yeah, so actually, after talking to the patient, you will be evaluated, no? So in this picture, actually I mentioned already earlier the other exam. So in this picture, it is very important. They are taking the intraocular pressure of the eye, no? So this is an applanation tonometer. This is the gold standard instrument that we use to measure the intraocular pressure. And then after that, you evaluate the angles, no? It's part of the diagnosis with a special lens, and then you look at the nerve. And then if you need to do more tests, then you order the visual field test, the pachymetry, no, which detects, I think we have a slide for that after this.
Right. Could you pull up that slide, please? There it is.
Yeah, if the doctor will suspect glaucoma, or even if the findings are normal, but you have all those risk factors, you are labeled glaucoma suspect because of a strong family history, the doctor can suggest this, no, or advise this one. So pachymeter or pachymetry detects yung thinness or yung thickness ng cornea, yung na-mention ko earlier, yung harap ng mata, no? So kailangan natin malaman kung makapal siya or manipis or normal lang. Then we will scan, no? Para yung optic nerve scan naman, para lang siyang CT scan, no? Pero yung optic nerve head yung kinukunan ng picture, no? Tapos may i-compare yan doon sa population para malalaman mo kung may mga thinning doon sa nerve fiber layer, no, doon retina. Tsaka yung visual field test naman, nag-evaluate ko doon sa functional status ng nerve, no? So if patient, yung mapaplot doon kung ano, saan hanggang saan yung nakikita niya doon sa visual field. Yun yung visual field test. Yung mga important tests. And then there are more tests pa as needed na lang po yung iba na idadagdag ng doctor. Pero ito yung mga basic glaucoma screening tests.
All right. So, Doc, once I'm suspected of having glaucoma, or they actually say I have glaucoma, no? What are the treatments that I can do before it becomes irreversible?
Yeah. So, first and foremost, again, if you are diagnosed with glaucoma, the doctor should um, see to it that there are no other medical cause. So you have to determine if there are any other cause or medical condition causing the glaucoma or eye condition, like if there's a very mature cataract or there's a very poorly controlled diabetes, and you have to do that. And then if it's really there's really a high pressure, then of course you can do pharmacologic treatment. So pharmacologic treatment, it comes in eye drops or oral medication. So the drugs in the market available for glaucoma, they act to decrease the pressure of the eye, no? So, ay, tayo pala tayo. Pero can I just go ahead with the treatment?
Yeah, go ahead with the treatment,
So,
Doc, and then we can go talk about the types after.
yeah, so it comes in oral and topical, no? So pwede eye drops, pwede oral na medication. So limited nga lang siya, but then it is available. And then after that, I think the next slide with the eye drops and then the oral medication. You can also opt for laser procedure. So we have several laser procedures. It depends on the type of glaucoma, no? And then sometimes kailangan timely yung procedure mo, no? So like special, yeah. So and then like an iridotomy. Iridotomy actually is making like a canal or a hole on the iris, no? So it can be done using a laser or manually, yung surgery talaga, no? You can do that.
Right. So, Doc, are these treatments of sorry. There's more pala. Sorry, Doc. Go ahead.
More. Yes.
Okay, go ahead.
Yeah. And then again, another laser, the cyclophotocoagulation. Actually, this is only used for refractory cases. Yung mga malala na with very poor vision. So very advanced with poor vision. Ang nangyayari dito, may parang yung middle layer, yung naggumagawa ng fluid, yun yung iti-treat para lesser na lang yung magawang fluid. Hopefully, bababa yung pressure, no? So eto. Tapos yung next naman, kung wala ka na talagang option for laser, tapos nabigay mo na yung lahat ng gamot, and then you can opt for a glaucoma surgery. Glaucoma surgery din, marami tayong glaucoma surgery. Yung very common is yung trabeculectomy, no? So, parang gagawa ka ng canal from inside the eye palabas, no? Para doon lalabas yung fluid na build up sa loob ng mata.
Right. Okay, Doc. These treatments, are they applicable to all forms of glaucoma?
It depends on the type of glaucoma you have, no?
Yes.
So basically it's a stepwise approach. Yung management naman stepwise, no? You can give medication muna, and then you decide on the laser kung kulang, and then you'll decide on the surgery. Yes.
Okay. So, Doc, what are the types of glaucoma?
Okay, so there are several types of glaucoma, pero ito lang yung mga major types, no? So first we have the open angle glaucoma, no? So yung open angle, I think we have a slide ba? No? So yeah, so that one. So first we have your open angle glaucoma. Ito yung pinaka-common na type, no? So sobrang bagal yung progression, no? So very gradual yung progression niya. Tapos dito ang nangyayari, yung angles open, no? It looks open, pero yung drainage channel, it is not working well, no? Hindi siya ganun ka effective mag-drain ng fluid, no? So magbi-build up eventually yung pressure, tapos pag na-build up na yung pressure, madadamage yung optic nerve, no? And then yun nga, etong kind of glaucoma na to, walang ma-feel yung patient sa simula, no? Up until advanced na, no? Tapos in contrast, open, meron din tayong close, no? So yung second na type is yung angle closure glaucoma. Ito naman may presentation siya. Ang nangyayari dito, yung iris, the brown part of the eye, nabablock, no? Nasasara niya yung drainage. So may biglaan talagang pagtaas ng pressure. So kadalasan ng mga pasyente, sudden, no? Biglaang blur yung vision, masakit yung mata. So, in contrast doon sa isa na wala silang ma-feel, eto naman sobrang sakit, sobrang blur, tapos may halo around the eye. So, etong kind na to, yun yung mga patient na pupunta talaga sa hospital to seek medical care. No? So, ito yung primary, yung angle closure glaucoma. Ito yung mga nag-a-attack ng glaucoma.
Right. Actually, Doc, I think I heard about there was a case, no, where this guy had gone to the Dead Sea in Israel, and then he accidentally opened one eye under the sea niya. Alam naman mga viewers natin that the Dead Sea is super, super salty. No, so they said that it burned his eye so much so that the fluids just started leaking, and then you could see the iris. Because his eyes were like a different color, his iris would look like it was leaking. So is that close angle glaucoma, Doc?
No, I'm not pretty sure. No, but I don't think so. When maybe the salt water just injures the eye. It's some sort of a chemical burn. So parang na-dehydrate yung harap ng mata. That's why you are tearing so much, no? And then
sorry, Doc, not naman tearing, but more of the, it looks like the picture sa open, sa close, sorry, where it looks like the iris is bigger than it should be, or
you mean the pupil? The
pupil. Sorry, Doc. The pupil, the black part is bigger than it should be.
Yeah, you are right, because angle closure glaucoma naman, they present a dilated pupil. Medyo malaki siya, no, mid-dilated. Hindi siya maliit, hindi siya super laki, pero hindi siya nagre-react halos sa ilaw.
Right.
I have not seen that patient personally, pero I don't know, we'll see. Maybe I can check.
Maybe I'll send you pictures after this stuff. But yeah, I just remembered when you were mentioning, okay, so the first type, yung open angle, is yung the ones where you really don't notice the symptoms, no? And then the second type is, for example, sudden burn, you go into the Dead Sea, you open your eyes. Those are the kinds of things. So then what are our other types, Doc?
Yeah, so there are more. So we have the open, we have the close angle, you have the secondary. So yung secondary naman, very broad to. So from the name itself, secondary. Glaucoma, caused by certain factors, no? So like, previous trauma na nagkaroon ka ng glaucoma, you have like an intraocular tumor or kahit tumor ng mga structures adjacent to the eye, no? And then if you are taking certain drugs, even eye conditions like cataract, no, it can cause secondary glaucoma, problems in the retina, like in diabetes, no, secondary yan. Yung mga may natitake na gamot, yan, they can cause also secondary glaucoma. As well as inflammatory systemic conditions, yung mga thyroid-related diseases, no, na nagkakaroon tayo ng thyroid-related ophthalmopathy. Minsan, they present with increased pressure din. So, a lot of factors can cause secondary glaucoma.
Right. So, Doc, mga types of glaucoma, because they come from very different causes, no? Are the treatments all the same for that? Because I know you mentioned a lot of treatments. Are there some that's only specific to that type of glaucoma?
Yeah, treatment varies, but generally treatment are given. The drugs are just to to lower the pressure. So parang may general effect sila, but which drugs you will use, what laser you will do, and that depends na on the type. Pero generally, yun yung mga gagawin ng doctor, ng ophthalmologist.
Right. And then, so Doc, up until what point does glaucoma become irreversible?
Actually, it's really irreversible. That's why we need to do all the glaucoma screening tests. So, back to the diagnosis, once you have that, you have a baseline test, and then you will be monitored. No, you will be monitored, and then there is this certain stage na we see in the CT scan or the optic nerve scan that you will see that it's already the worst that it can get. No, yun na yung pinakamalala, no? So we call it basta may makikita kaming finding doon. So hopefully lang we will just can do early detection to slow the progression, no? Kasi irreversible nga siya. So once it damages the nerve, yun na siya. Nag-start na siya. So it's a
Right.
matter of early detection and slowing the progression. No?
Right,
Pababa
Doc.
ng pagkabulag.
So, what symptom are we gonna observe when it's already too late now? Now you know
Yeah.
when you have that symptom, it's okay. It's no hope, or I should really go see someone now.
Yes. Yeah. Actually, a lot of patients that I see, no, especially last year during the COVID lockdown, no, they came to me and they have very advanced stage now of the disease. So they can only see very small central vision or very poor vision. And one clue that it's already very advanced that a lot of people kasi they just go have their eyeglasses changed. No matter how you change your glasses, no, you update your glasses, it will not improve. That's already a clue. But you have to make sure to rule out that there are no other eye conditions like a maybe it's just a cataract, no, that's why you cannot replace the glasses because a lot of patients come here, doc, I've been changing glasses for several years and then I think it's still getting worse and then they have glaucoma.
Right. Okay, Doc. So, that being said, I don't think any of us really want to get to that point, no, mga viewers natin. So, how do we prevent
Yeah,
it, Doc,
of course.
before we even see the early signs?
Yeah, so since you have to, it's very important to detect glaucoma earlier, then you have to know these important preventive factors, no? So first, you have to have a regular eye exam. So it should be comprehensive, no? Hindi yung flashlight lang, then okay na. So a regular eye exam, meaning a thorough eye exam by an ophthalmologist. There's no hard rule on how often you do the eye exam, pero may mga recommendation yung like sa US, no? Like if you are under 40, you do it every 5 to 10 years. And then maybe 40 to middle of mid 50s every 2 to 4 years. And then as you grow older, mas frequent na siya. So when you're like around 65, perhaps you just have to do a regular an eye checkup every year, no? But if you are diagnosed with glaucoma or if you are risk for glaucoma, then you should have a more frequent visit to your ophthalmologist. And
right. And I think that's something you consult with your ophthalmologist, no, Doc?
Yes.
Yes.
Mm-mm. And also next, you have to know your family's eye health history. So since glaucoma tends to be familial, no, nasa lahi siya. So we should know, dapat alert tayo or dapat alam natin yung mga relatives natin. So if you know of somebody sa family na may glaucoma, you have to have an early check-up, no? You do not wait na may ma-feel ka na, may maramdaman ka na malabo na yung mata mo or masakit before you go to a doctor. And then also, you should know kung aggressive yung glaucoma sa family line nyo. So meaning if may relative na nabulag because of glaucoma or may relative ka na naoperahan dahil may glaucoma o glaucoma surgery, meaning aggressive yon. So you have to be very OA, kumbaga, no? Kahit wala kang ma-feel, go ahead and have your eyes checked. Basta may strong family history. And then, if you have glaucoma or not, our next preventive factor is preventive care is to follow your doctor's instruction, no? So if you are told by your doctor to come back next year, we will evaluate, then you go back. If you have glaucoma, the doctors will give you a list of medication. You comply with the meds, you comply with the schedule, you go to the doctor for the follow-up if may naka-schedule, yung mga ganun. So very, very important to follow the doctor's instruction. And then I think next is exercise. So not any exercise, no, safe exercise. So regular moderate exercise, they say, can prevent glaucoma kasi they reduce eye pressure. So, but you have to remember also that there are certain position and there are certain exercises na nag-increase din ng pressure. So you have to be just informed, no? Parang you can ask your doctor on the appropriate exercise regimen yung gagawin mo.
Right. So, Doc, yung inappropriate positions for the eye pressure, the higher risk ones, I'm assuming they're mga inversions, no?
Yeah, yung mga face down, yung mga headstand, yung mga ganyan, not so long. Kasi transient lang naman, no? Temporary increase in fan. Tapos yung mga weightlifting, no? They can cause increase in pressure. Not so high, pero they can affect, they have an effect on the intraocular pressure. So, if you may glaucoma ka tapos nagli-lift, medyo dangerous siya.
Right. I think that depends also, Doc, on what our own eye pressure is, no? So, mga viewers, if you are suspected and you're not too sure whether you can lift weights or not, or if you can do inversions, what do we do, Doc?
Yes.
We consult our ophthalmologist.
Yes,
Okay.
And then lastly, yes, you have to protect your eyes. So protecting your eyes, you protect, well, it depends on the activity. If you're in a workplace and you have all those mechanical instruments, also those moving object, you have to wear protective goggles. If you are engaged in sports, contact sports, you have all the ball flying in front of your face, then it's better to wear the appropriate protective eyewear. And then protect your eyes. Also, you have to have a regular checkup again. And then you have to live healthy living. You eat healthy, then you have enough rest, appropriate exercise. Do not abuse your body and your eyes. No, so yun yung mga protect your eyes na magagawa natin. Ano yung things to protect your eyes? Aside from the goggles. So lastly, yes, healthy diet and some supplements can help you in the prevention of glaucoma. No, so actually in the overall health of the eye. So kung healthy yung eye, then that's much better. And if you can get it in the supplement and diet, then do not wait na dun ka na that the time that you have glaucoma, dun ka na mag-take ng mga supplement or modify mo yung diet mo. No, so if you're normal, then you just live healthy.
Okay, thank you, Doc. So I think I want to go through our comments here. I see we have 120 more comments since I last checked.
Okay.
Baka my questions.
Yes.
So we have a question here from Tara Oracion. They pull that up. In the meanwhile, while I'm waiting for our questions to pop up on screen, I'm just going to read through our viewers and give them another shout out. So here we have Cecilia Jane Bartolome. We have Angie Matias. We have here Ditas and Emperador Tolentino. I know Ditas is a regular viewer. I always see her in the comments. Hi, Ditas. We have MJF Regis. So, Doc, while we're trying to put the comments up on screen, I'm just gonna read them. It says, "Mahal po ba ang gamutan kapag may glaucoma?"
Again, come again, Ma'am Luisa. Mahal?
Yeah. Mahal po ba ang gamutan kapag may glaucoma?
Parang expensive. Yes, actually, glaucoma is a very expensive disease. No, so yung mga test pa lang mahal na. No, so I always tell the patient na pag may glaucoma ka, hindi siya biro, no? Kasi yung mga test tsaka yung mga magamot, very very expensive. No, so hindi yung usual na a few hundred pesos, no? They can cost up to over 1,000. No, so very important kung elderly, at least meron silang yung mga discount. No, very very costly, very expensive siya na disease.
Right. That's why, mga viewers, that's why we have to live the best lifestyle we can right now. Yes. Healthy. Prevention is always better than cure, and we see this in all of our past Wellness Wednesdays, especially the mga regular viewers natin knows this.
Yeah,
It says, oh, okay, we have another one. Rosalie San Diego.
Yeah, so Doc, can I just read it?
Yeah, go ahead.
Ano po yung mga nararamdaman sa mata kung may glaucoma? No? So, again, kadalasan sa glaucoma, walang maramdaman nung una, no? So, pero pag matagal na yung glaucoma, doon na sila may maramdaman. Like, papangit yung vision or hindi mo makita yung gilid, yun yung pinakauna yung sa side, no? Didilim yung side. Pero may mga glaucoma din, no? Like yung angle closure, na talagang bigla ang sakit ng mata, bigla ang labo, yun yung mga iba pang mga feel. Tapos namumula yung mata. Kasi depende yan sa klase ng glaucoma. No,
right. And if you could read the next question.
Yeah. Namamana po ba yung glaucoma? Yes, oo. So, highly familial yung glaucoma. Kaya, kailangan nating malaman kung nandyan yung meron tayo sa family. So, kunyari, may pasyente ako, no? Tapos, may glaucoma siya and na-diagnose na siya na may glaucoma. Tapos, tatanungin mo siya, may history ba sa glaucoma sa family? Sasabihin niya, wala. Now, meron na. Ikaw yung history, no? Meaning, you tell your relatives, no? Sabihan mo yung mga kamag-anak mo na may glaucoma ako, meaning nasa pamilya natin, no? Nasa lahi natin yung glaucoma. Kasi, highly familial siya. Yes, namamana siya.
So we have here another question from Miss Bianca. She says, yung father ko po, parang cloudy daw po yung isang eyes niya, pero nung nagpa-check up siya, wala naman daw po. Tapos, mga ilang araw po, na-stroke na siya. So, do you know what could have caused that, Doc? Possibly?
Yeah, actually, baka yun yung mga signs na, yung mga naunang signs ng stroke kasi, no? Minsan, may lalabo yung mata. Stroke kasi, maraming klase. May stroke lang sa mata, no? Tapos lalabo yung paningin nila. Tapos, meron ding, yung parang nagdodoble yung paningin, tapos a few hours or few days, stroke na pala. So, marami ding presentation, no? So, hindi siya straightforward na glaucoma siya or kung mararamdaman mo na to after 1 day or 2 magsustroke ka. So marami pang consideration. So yung lesson lang dyan, huwag mo siyang dalhin lang. Yung parang i-tolerate lang, no? Seek medical advice right away. Kasi marami, inom lang ako ng pain reliever. Ganon. Tapos lumala na siya.
Yeah, but I think, Doc, her father went to a doctor already. So I think something also to say is that maybe get more than one opinion, right?
Yeah, actually, maybe perhaps that doctor did not see anything wrong with the eye. Tapos, yung stroke niya, wala siyang presentation dun sa mata. Kasi minsan naman kasi transient, no? Transient lang, meaning temporary lang yung yung naramdaman nung patient.
Right. So we have here a question from Michelle Macala. She says, Doc, parehas po ba ang mata ang sabay magkakaroon ng glaucoma or pwede isa lang?
Actually, pareho, no? So pwede isa lang, pwede both. No? So yung mahirap dun sa isa lang, because we always open both our eyes, no? Open siya both hindi naman tayo gumaganon, no? So if isa lang, those patients cannot identify. Hindi nila masasabi na lumabo na yung isa. So very important din siguro, kahit hindi tayo nagpapa-check up sa doctor, you cover your eye at that time. You check lang the vision kasi minsan mabibigla ka nilang pag ganun mo, ay malabo siya. So I always tell the patient na you check your eye one at a time kasi to know. So kasi yung glaucoma, it can happen to one eye only or both eyes. May mga types din of glaucoma na usually bilateral, yung dalawang mata. Hindi sabay, pero may tendency yung isa na magkaroon din.
Right. Right. Thank you, Doc. And so we have a question here from Alulade who says, is glaucoma po dangerous or deadly?
Yeah. Okay. Yeah, dangerous is dangerous. Sorry, glaucoma is dangerous in the sense that it is a visual threatening, no? But hindi naman siya most of the time hindi naman siya life threatening. But then the quality of life will be very much affected if your vision is affected, no? So pag very poor na yung vision, yun yung parang deadly na siya kasi doc, mas okay pa mamatay na lang ako kaysa hindi wala akong makita, no? So indirectly yun yung effect niya.
Right.
Oo.
Right. So there are still those other considerations. No?
Yes.
So like it's not life threatening, but that doesn't mean we ignore it. Kasi yung quality of life natin, doc, is still a very important thing to consider.
Exactly. It will totally change.
Okay. Okay. So, Doc, we're reaching the end of our time here, and luckily for us, we got to go through all of the questions. We had so many. I think we got through all of them. We had so many questions, Doc, and at the beginning we had none, and they all left it to the end. So we were right in our prediction, Doc.
Yes.
So I'd like to say thank you for joining us here today. I think we learned a lot from you regarding glaucoma. So if you could just give us a quick summary, Doc, what are our main takeaways? If we are to take away anything from this one Wellness Wednesday episode, what is that?
Okay, so remember, glaucoma is an optic nerve damage. And if glaucoma is there, it will cause permanent damage, meaning irreversible siya. So, kasi irreversible siya, means it's very serious, no? So you have to worry. Sa yung title ng anong topic natin, if you really have to worry about glaucoma, something like that, you have to worry. So to avoid progression of glaucoma, yun yung take home early detection. So regular check-up, early check-up nung dun sa ophthalmologist.
Right. Okay. Thank you, Doc. So thank you for coming.
For having me.
Yeah. And I hope to see you some other time when next time we come across the topic of eyes.
Yeah, no problem.
Okay.
Thank you.
Take care.
You.
Okay, so mga viewers natin, can you please comment your takeaways below so that the rest of us can also share in your learning? Because for me, I think I learned a lot also. For example, two of the biggest takeaways was that glaucoma was actually irreversible, and it's the #1 cause of irreversible blindness in the world. Not only that, but it's preventable. So that's my second takeaway. It's preventable. Preventable by what means? Healthy living. I think that covers all of our diseases throughout every episode of Wellness Wednesday. Most diseases, viewers, are preventable. If we just live a healthy lifestyle, proper diet and exercise, as well as continuous monitoring with the doctor. So for example, a lot of the risk factors with glaucoma are related to lifestyle, such as diabetes and high blood pressure. Family history, can't really do much about that. But there are things that we can do to help ourselves in the future and improve our quality of life. So that being said, mga viewers natin, we just wanted to announce the winners for our game. Oh no, the winners I think will be announced in a separate post towards the end. So for those who participated in the game, I just like to say thank you. You'll be getting a chance again. Just a reminder, you can still comment. Actually, yes, I'm being informed right now that you can still comment so that you get a chance to win this blister pack and or an acai choco or acai choco or acai coffee trade box. Each of these have 10 servings, so you can just try them out, share them with your family and friends. And speaking of sharing, if you want to share more, You can check us out at Olani PH here on Facebook. Olani is our official reselling platform for Organique products. Our motto here is, what is our motto? I think it's share the health, spread the wealth. Yes. I always get confused with the share and the spread. So in my head, sometimes it's like spread the wealth, share the health. Share the health, spread the wealth. So please don't forget to check us out there at Olani. We also have our official website that you can check out for more products, as well as the numbers below if you were interested in inquiring some more. So thank you. That wraps up the end of today's episode. Oh no. See, I'm so sorry. I thought our viewers were for the next post. Anyways, so viewers. So our winners are and I've seen some of these winners in the comment section, so congrats. First of all, we have Joy Vierja, we have Michael Pot Pagtama, we have Ditas Emperador Tolentino, who is getting a lot of Organique acai products now, because I always see her commenting, and she has won more than once now. Leslie Ann Alvaro, and then Bjorn Manhaven, or Manheaven. So congrats to our winners. I hope you can enjoy our new products. And then also, we will be reaching out to you as to whether you prefer the acai choco or acai coffee. Now that concludes the end of our episode. Finally, I'm sorry for the confusion there, and then the kind of internet disconnect we had there. We had this technical difficulty with our signal. But thank you for being patient with us, and stick around for the next episode. If you have any suggestions as to what future episodes or topics you want to see, please leave them down in the comments below. So have a great night, everybody, and take care.
Wellness Wednesdays with Organique. We care because you matter.